Well, thank you, everyone. This is Donna Atkinson with the Collaborating Center for Indigenous Health. I'm going to skip right now into the question and answer session. So first question is, what are your experiences and thoughts around the intersection of Indigenous women and girls who are also living with a disability?
I think intersectionality is a concept that's used a lot, but as we know, it's something that we all struggle with trying to address in practical, tangible solutions. But as part of the inclusion unit at NWAC, I can say that there has been a considerable amount of work being done to address the systemic barriers that continue to marginalize Indigenous women, girls, and gender diverse people, but also those who face additional intersecting barriers, such as those to inclusion. I will say that NWAC is currently working on a project at the moment that is looking to address the Accessibility Canada's Act and talk about how there are unique or distinct needs facing Indigenous women, girls, and gender diverse people as additional barriers to access. So I think it kind of circles back into a broader conversation about what is it to be in a distinctions-based community, a community that has a unique set of legislation, unique policy and legislation landscape, and how do we ensure that any broader policies help to address some of the unique needs and policy landscapes that those individuals are living in. And furthermore, we do understand, based on previous research, as well as with our engagement sessions that we've had to date with folks who represent those with disabilities who are from Indigenous communities, various distinctions-based communities, that there is a continued need to ensure that legislation is representative of what constitutes a disability and, again, the policy legislative landscape in these distinctions-based contexts in order to then move forward to addressing the barriers. It sounds like a very broad answer, but this is something that NWAC is working on currently to address and needs to continue to work on in order to ensure that not only are human rights recognized, but need to be recognized within the distinctions-based context in Indigenous communities, and a concerted effort both from a community-led level, but also recognized on a federal level with policy and legislation, as well as service provision and resource allocation.
Great. Thank you, Candice. So one of the key findings was that accountability was key. So what are strategies to empower vulnerable groups, given that rights and responsibilities go hand in hand around accountability?
This is a great question. I think at NWAC, where we are well positioned in this space is that we are a confederation of provincial and territorial member associations. So accountability is key, right down to being community-led and driven. For us, it's really important to ensure that not only as a national Indigenous organization, that we are also responsive to our provincial and territorial member associations. And within those individual PTMAs, they are representing their communities. And so what we do is throughout many of our projects where we either make recommendations to policy changes or we're informing service provision or training measures, a large component of what we do is community engagement with our provincial and territorial member associations, but also with other communities to ensure that anything that we're doing is community driven and reflective of the diverse needs of our communities. Again, too, I should mention that because we are constituting all of these provincial and territorial member associations, we do have representatives from each of them sitting on our board of directors as an organization, who once again is ensuring that NWAC has a finger on the pulse of the needs at the community level, but is able to also represent on a federal level.
Thanks, Candice. So we have a question from a participant. What are your thoughts on the Government of Canada's delayed response to the report in terms of, is it acceptable due to COVID-19, or are there other reasons that were shared with you? And how can allies help you move forward with it?
Okay, so I can, actually, I'm just going to start with the first question. I'm going to just give my two-second perspective. So on the person with disability, so for me, it's a really, really important issue, because we know that there is more economic issues more vulnerability among persons with disabilities. So we also know that, some research suggests that there is violence and systemic violence against people with disabilities. So they definitely need to be included in this broader issue of systemic violence against Indigenous women, and we need to find a way to be able to address this important issue. On the issue of accountability, so this is probably one of the most important areas for in order to be able to make progress in this important file. And I'm just going to talk about accountability to government. And so it's a broad issue. It's an issue that affect the government of Canada for sure, who is the lead on the file, but also a number of provincial and also a number of local government. And finding the balance and finding the way to establish the accountability, I think it will also be a key to the success of this project. There's many areas where there's big levers, like for example, if you take welfare, it's in the hands of the provincial government, not in the hands of the federal government. So, and then we know that shelters are more the responsibility of cities. So accountability across government is key, and NWAC has been advocating for clear accountability and also reports card. And so that's why leading to the third questions with respect to the delay of the national work plan. So if you want to know what NWAC has been saying, so we have on our website a section that deals specifically about the 1-year anniversary of the MMIWG file, and our president made some very strong statement. And she thought that the delay was that there are still Indigenous women almost on a daily basis who are victims of violence, and we need to be able to act quickly and swiftly on this important issue.
Thanks, Christian. So we have a question. Are there any resources that propose specific roles for public health services and public health professionals in reducing violence against Indigenous women, girls, and gender-diverse people?
I will jump in here. There are a number of resources that we would be able to happily provide. In fact, what I will say is, instead of listing them here, we could give a better cohesive list if this person were to contact us, as their general email listed on our website. But what I can also say is that, for example, we have a project that is going on at the moment where we are working with members of the Indigenous 2S LGBTQ community who have experience with gender-based violence, as well as service providers to those who have experienced gender-based violence from Indigenous communities from this particular 2S LGBTQ perspective. And we're working with them right now at the moment in order to devise a training program in order to better address the barriers to services and enhance the service provision for Indigenous women, girls, and gender-diverse people who have experience with gender-based violence. The results of this research will be made available within the coming months. And at that point, too, should this person wish to contact us, or anyone who is interested in the work that is going on at NWAC is welcome to contact us, and we can provide that at that point.
And I would add to that this is probably the key question that the Canadian Minister has been asking about this MMIWG file, was to identify at the national level and provincial level as well, the best practices, the mechanism that really work, that really affect, and can help resolve this important issue. So we do have a number of practices. We have also a number of resources available, as in this mentioned, that we could make available.
Great, thank you. So I have another comment here. Someone thanking you so much for the presentation, and just wondering if you could talk a bit more about how UNDRIP implementation could help address systemic barriers and problems, and how NWAC is involved in these discussions with the federal government.
So I think I could address maybe the first one, and Christian, perhaps as you have been jump in as well on the second half of that question. But as we know, international legislation and frameworks help to ensure that we have consistency across the board and help to guide, for example, with Canada, working closely with trying to align with existing international framework, ensures a degree of consistency even within Canada. And when we talk about accountability, it's about ensuring that Canada on a federal level, but also trickling to the provincial and more community-based levels, is staying consistent with the most relevant frameworks for human rights and protecting human rights. So in terms of what NWAC would like to do, as it was very clearly coming across international roundtable, is to ensure that we have a good understanding of what UNDRIP is representing, and of course ensuring that human rights are being respected, but that is also being upheld on especially the national front when it comes to addressing systemic barriers to the MMIWG. I'll turn it over to Christian in order to elaborate further on the second half of that question.
Yeah, and I will start by saying that the international file, it's so important because at the end of the day, the most important thing for us as an advocacy group and a lobby group to defend to government is really, it's like, it's the legalistic, lens and the rights of Indigenous people. So having this framework that really helps us to have more targeted, measure and initiative. It's definitely UNDRIP. It's definitely a file that we're going to be that we follow very closely, and we're going to be, continuing to do work with our international partner, United Nations, being, probably the biggest one, but also the Organization of American States, and we hope that that we're going to be in the position to keep, the projectors on the rights of Indigenous women.
Great, thank you. So what has NWAC done, or are you planning on offering any specific engagement, workshops, training, or support for Indigenous health and social service providers in the near future?
I will jump in and say that we have Shanisa Ryan, who is the director of our health department, who has been very active on a number of policy areas related to health, and many of which deal with training for healthcare providers, specifically those dealing with Indigenous communities, and including those of to LGBTQ Indigenous members as well. I would say that it would be worth certainly checking out the information that we have available on our website, and certainly following up with Shanisa as well in order to have, if you have any lingering questions specifically about NWAC's work in a particular area.
Candice is mentioning, I think, if you have specific questions or looking for information about healthcare and training, Shanisa has been with NWAC for a number of years and has a really strong understanding on health care issues as it affect Indigenous women. So we'd be more than happy to get back to you.
Okay, so we have just 10 minutes left. I think we have time for one more question, and then we'd like to try to get Elder Roberta back on the line again. So last question is, although there's a lot of discourse right now on policing services in relation to murdered and missing Indigenous women and girls, and it's focused a lot on oversight mechanisms. This person is wondering what NWAC's perspective on the growing calls to defund the police is.
So, MMIWG and policing. So we do have, we've been actually very active last week on this issue, the week before. So our president, NWAC president, is in close contact with RCMP, and we're going to be working with them. We're also looking at the possibility of doing a memorandum of understanding between both organizations, and because I think they need the help of Indigenous people to, explain and let them, understand some of the issues and barriers, and some of the problematic as well with respect to mental health. So this is an area that there's a lot of work, that needs to be done, and we need to do better than the current situation. But I can tell you that this is front and center, and it's really, really important and what precedent to be able to show some progress. And there is also definitely willingness from some policing organizations across the country to work with Indigenous groups to try to address some of the most issues, most important issues we've been seeing in the media more recently. So I'll leave it there. I don't know, Candice, if you want to add anything to the question.
I think that's a pretty complete answer. So thank you.
Okay, I think with that, we're going to try to connect Elder Roberta again. Roberta, are you with us?
So it's the presentation was something very informative. I like what was said, and also just to put a little bit more to the MMIWG is the soliciting and selling of our women and possibly young men too. Shows it's trafficking is another way that is kind of included in that area too. So just to add that, and we have a group of grandmothers working and community members who are trying hard to support that, and also with the murdered and missing and Snabekweok. So we have a lot going, and there's a lot more to be done in that area. And it is quite the movement across the Indian country. And is it closing time?
Certainly, yes. I'm just going to say before we close that I'm really sorry we didn't get questions. There were a lot of questions. We do encourage you to connect with NWAC with any questions that you might have. And thank you so much to all the presenters today to be able to talk to this very important topic. And we thank you very much for sharing your knowledge. So please, Elder Roberta, if you could close. Thank you.
Thank you. Again, thank you for everyone participating. Miigwech, it's a gift that you can do this, and it's a gift to learn from everyone and from each other. We thank the Great Spirit, all of creation around us, our medicine, our clans. The grandmothers and grandfathers in the directions of the East will teach us how to look in a good way, in a positive way. And in the South, they teach us the love that we don't have and we are not knowledgeable of, and they teach us more, and that holds us together. And in the Western direction, that we ask the grandmothers and grandfathers there to help us to let go of things that we don't need to carry, to understand our ancestors, and that our ancestors live that, but they can also teach us in what we need to do and continue our lives for them. And in the North, we have that movement there that all our people and our ancestors can stand around us and help us walk and guide us. And if we fall, they're there to help us again, to stand back up and continue our walk. We thank Mother Earth for being here, for holding the water for us and trying to keep that clean and healing for us all to take upon us to be able to work with it and for ourselves. We thank the medicine for being around us and for being there for us when we need it. We thank our grandfather who shines on us every day, and the grandmother who comes to us in all shapes and sizes every month. We thank our Father Sky for being here, the stars for shining light, and all of the animals that check in on us once in a while to make sure that we are doing what we are to do as they loan us this land and this place of living. So we take care of it. And the thunder beings that appear and that come and visit us, they're there also to guide us, the lightning, to show us how sharp we can be and where we can go and how we can do things. And the rain to cleanse, and that is including with the water. Do we cleanse ourselves So we thank all of creation, all the ones that have participated in this year, and there will be more. And we encourage you to find your resources, to call the organization and the support lines to help in this area so that we can find what we need to support our own people in everything that we do. Naho, miigwech, kina, miigwech, miigwech, miigwech. Thank you.